Welcome to the Mindset Matters, the podcast where psychiatry, medicine, and real human experiences collide, all through the eyes of two psychiatric PAs.
We're your hosts, PA Mercedes Dodge and PA Jessica Spissinger, two passionate psych PAs on a mission to bridge the gap in mental health care.
So whether you're a provider just here to level up your psychiatric insight, increase your mental health skills, you're in the right place.
Each episode, we shine a light on the incredible work PAs are doing in psychiatry and beyond. Our goal is to build a community focused on better patient care, professional growth, and personal well-being.
This podcast, a little disclaimer, is for educational purposes only. We're not here offering medical advice, psychiatric advice. If you or someone you know needs support, please reach out to a licensed mental health professional. All right, guys, let's dive in.
All right. So it's Yuliya.
Correct.
Really beautiful name. How did you hear about doing this today?
My supervisor told me about the conference, and then I just read the email, decided to sign up.
Well, good for you. Okay. We started this podcast because we were really interested in knowing what all these amazing PAs are doing all across the country. We'll get into this a bit more, but for most of the PAs I talk to, especially if they're in outpatient practice, they're often the only PA surrounded by NPs and MDs, and interprofessional care is great. But it is also nice to know what's going on with PAs spread out across the country. So I'd like to know a little bit more about you as far as when you decided that you wanted to go into psychiatry. Did you already know it going to PA school, or did it kind of change and transition along the way?
When I started the PA school, like psychiatry was one of my first ones, university.
So you had psychiatric rotation.
Yeah.
And when you graduated, did you immediately start looking for a job in psychiatry?
I did, yeah. So my preceptor at the time, she was working for my current company. And I was really impressed with her as a person and also as a provider.
It's been about 3 years.
Correct. Yeah.
So tell us a little bit about how you went into addiction medicine. Did I hear that right, that you do some addiction medicine in your
Yeah,
practice? Tell us how that's integrated in your practice.
I mean, as a person, I always was wondering, why did people allow something external to dictate making important decisions under the influence? And I remember as a person, I always thought, I want my mind to be as clear as possible, so it will be my decision.
Was that something you were exposed to addiction medicine in your training, or is that something you kind of got ambitious to conquer after becoming PA?
So that was also a part of the addiction treatment as a part of the training. And I was also always terrified of being addicted to something. So I would kind of work on myself, others.
I know curiosity just really helps us keep on learning. And it sounds like you have that spark that even if you finish a textbook, finish a course or curriculum, you're always curious how it works in people's lives, your lives. And it's so you constantly are layering more education. So are you someone that learns through live interacting more, or do you do audiobooks? Do you do articles? What is your to-go to keep on doing that clinical learning?
If I'm very passionate about it's going to be books, because then it gets, deeper understanding, right? It won't be something kind of, big picture. I want to know something, without to the bottom, essentially, right? So books and right? Articles are like a quick fix and stuff like that. And if I need fast answers, open evidence has been,
Evidence, right?
Yeah.
It's weird.
Yeah.
I do reflect today. I just like it so much more.
It's so much practical and applicable. I mean, up to date is great, right? But then
I get lost in the
I don't need to know 152 people did this. I just need to know something very practical. All the supplies.
Yeah, no, I completely agree. Is there any particular books that you're reading now or completing before the end of the year?
I mean, I'm going to do those goals and read it continuously. So the book that struck me recently is called The Choice. And this is by the lady who actually became Psych D. And she's a Auschwitz survivor from Hungary.
I have read that book. It is an excellent book.
It's an amazing book, like PTSD.
Like resilience.
How do you not become a victim? How do you become a survivor?
Next to Viktor Frankl's Man Searching.
I read it after that.
Yeah.
I'll have to check that out.
You haven't read that?
I haven't looked yet, but
I've read it twice.
So you're like a perfect combination.
It's both. Wrote them both. I got it up. You really got there. That's a wonderful book. You're right. I have it. I haven't thought about that book for a long time, but that's wonderful. We're going to have to tag that book because I do. So there's a lot of readers out there and we love medical information. I mean, I'd still love up to date, but it is dense. I need time. That's why open evidence is great when you're like, I have a specific question with these specific variables. Can you bring me a more of a clinical synopsis of what I should be thinking? Which is exactly what we need. It's like, definitely, I do don't know.
And like back to your original question, how I'm going to conference.
Yeah.
So really in the field, right? My supervisor, I could sure.
It sounds like it.
Yeah. So I mean, he told me about all conferences, and I have attended.
How many conferences have you attended this year?
Well, it's with the Mayo Clinic conference, right? Then I did the NEI conference, the Colorado one. It was two I did virtually, and like this one, I mean, climate, it was very easy. So I just,
Yeah. I'm so glad that you came here in person. I think it adds an experience if you know that there's a lot of us out here doing this work that's spectacular. Yeah.
Do you have some kind of areas in psychiatry that you're really curious about learning more about?
I mean, I love like trauma and like the origins between like trauma and PTSD, right? So how do we not end up in PTSD, right? There was trauma, right? So this is like a near passionate subject, right?
Home and you feel like it was worthwhile. Like I'm in the career that I'm supposed to be. Yeah.
Did you meet a PA that made you decide to go to PA school? How did you?
What was your origin story? Your PA origin story?
So, I mean, my third career was Native American revitalization, right? And Ojibwe language, right? So I used to be an instructor in Ojibwe immersion school, and I was doing 8 full days in Ojibwe, right? In a school
In Minnesota?
in Minnesota. And as of then, I was passionate about, and my PhD was about like Native American.
PhD.
I'm doing a PhD in literature, linguistics, cultural studies. I mean, it's mostly literature. Right? So, like, I was studying the work of ways for go back undergraduate. So, that got me here. So, I got a full scholarship that's there. It's here, right? So, I mean, so anyway, so I was doing Native American revitalization, and then I was an interpreter at that time also, and I was like, okay, so this is kind of temporary. I think I can get a resource. I think this like intelligence and hard it in could apply. So I started looking, and I was interpreting for somebody who turned out to be a PA. So what is PA, right? And then I started doing the digging and stuff, and then learned, okay, there are NPs and PAs. And then PA model appeared to be more interesting to me. And it made me cool because I don't have Fortland all my prereqs. And so again, the first shot to get into PA school, and I did. So my full mom had go to medical school. My parents, the doctors, my parents, my grandpa was like a great medical PA. And grandpa was like a PYNMD, right? So my mom walked like 3 times to get into medical school because of stuff. This. So I thought I don't want to have multiple attempts, one and done, and that's all got in. Had great people along the way here.
That is amazing. How many languages do you speak?
I mean, my first 2 degrees were like English, German, and French.
Okay.
That was in 2000.
Okay.
And so then I did Polish, just for fun. Right? Then I did Ojibwe, like I finished which, right?
Plus Ukrainian.
Plus Ukrainian, Russian, and Native, which I'm studying Italian.
It's so fascinating because so many times when parents are pressuring their kids into a certain career, so often it's medicine, especially, you know, if you were not originally from the United States. So it's interesting to me that they're pressuring you to do something that a lot of sometimes parents are going the opposite and they're like, English literature, that's not practical.
I think you said it why. I'm like Soviet Union, right? And my doctors, my parents were the doctors who didn't take bribes. And back there, the compensation was more than frustrating, right? So my parents at that time did not want me to come in that same situation. I love English and it was like easy for me, right? So I chose that. Still, but then I never teach.
Your brain is so interesting. You have, you know, I know we simplified like the right brain and the left brain, but it sounds like you have a lot of things that interest you and you look at it differently, I would assume. So, being that you are into a lot of things and you have a literature background, what do you do to relax and your hobbies? Like for me, it'd be I like writing actually. I like writing poems and stuff. So would that be your hobby? What is your hobby? I'm curious, like with your brain, what would be your hobby?
What should know if they might need some work. I used to write like poetry, especially in English, but that was in my first use. Now in my second use, is that cool?
Oh, and I love that. I am in my second
I'm
use.
in my third, but I'm looking for it.
It's cool.
I like
So I mean, I love like cooking and baking. You know, making something very elaborate. So like I like to make very pretty desserts, right? So I make candy. I like truffles and stuff.
they're amazing.
Yes, to be honest, yes. Because I mean, just stating the obvious of being boastful or anything. So I do that. So then I love like traveling and like hiking. So now I just finished like the 2 week,
That's wonderful.
so that's stuff. I'm gonna go to Iceland also.
They're the summer.
Yeah, like in summer. So I do that. And like my everyday kind of relaxation meditation. So I just do walks. So starting I just finished marathon, Twin Cities Marathon. Right. So that's what helps me, like when I'm running, that's the
Yeah.
that looks like came like patience, already great stuff.
Good.
So just the brain is empty and heavy, and I can just, observe, feel, just be a biological organism
Yeah.
versus, oh my God, yeah, responsibilities. So I mean that and like any other sports. So
You like everything's in the body. And
yeah,
we
yeah.
feel my
So I mean, this is that's so
And for,
realistic.
yeah, talking about preventiveness, PTSD and the trauma, story is like making sure you remain grounded in your body and that body and mind connection. And running is, I mean, for me, exercise is my happy place. And so it's like being able to do that allows me to not zone out or dissociate with things happening that are really hard, um, climate, everything going on. And it's really great that you take that time to just connect with your body. Jessica has run. I did half marathons before too. So it's been really lovely. And I love hiking. Hiking is also just the outdoors and that connection. It's definitely a missing piece in a lot of people's lives.
That's why I chose to come here. Is like I can't miss this, especially after the blizzard.
for sure. We actually have talked about doing like a virtual psych PA run at some point. And I hope that on our maybe mental health med. Yeah. So if you were to talk to a PA student now who's like, I want to work in psychiatry, like how do I do it? How do I make it work? What would you tell them?
Just have no expectations and just look at things what would be, and just like everything is a white blank page, right? You fill it with what you see, and if like try not to assume things, try to ask, so then you will actually get feedback, and like be prepared that today your patient's telling this, but then the next day you may hear the absolute opposite. And it doesn't mean that you are failing as a clinician not to notice those things, but the patients change their mind, or maybe they feel like comfortable with you, so they tell you the truth. And of course, before that, maybe it was 50-50 or, I mean, I would start there.
I love that. That's really great. I work in PA education, science, and teaching. I was talking to my students the other day about how they start in PA school really focused on the medical model, with this idea that you can like fix the disease, fix the condition, whatever it may be. It has an answer.
You're not the best. So we will never fix it, and we want to be comfortable with that, right? Or we can offer them the tools to fix it, but for some reason they cherish the misery, right? So, and that's why like our effort is nothing without their desire to be helped.
Which from imagination.
It's so that's why it's like I want to know that I'm doing my best. I'm not making assumptions. I'm meeting my own end, and I'm doing my best to kind of help them see the world how I think I'm seeing it. So they would hopefully get involved and would want to, make a difference versus, oh, it's even be better.
I love that. Very patient centered.
Very patient-centered. And also, it's also, I think, centering for us as the clinician or the psych PA is that we are part of the journey of the patient. And I think that if we kind of have that type of mindset, then it allows us to kind of actually, and this is kind of odd, but enjoy the sorrows and the joys of our patients. And because there are going to be sorrows, and this is not something that life is always going to be perfect. And so if you can enjoy that journey and still gain something from both of those, and as a clinician don't have those expectations that everything is going to be perfect and be fixed, it kind of, that release allows you to be present with the patient.
Yeah,
And be yourself.
to be like real versus by attachment and I impose my model on
Yeah.
reality.
Yeah.
I want just like I want to see the world through their lens, and hopefully they will see the world from my lens, which I think in many aspects I have a healthier friendly outlook, right? And again, no judgment, just externalize it. So I think I kind of more than their patient in regards. So
I love that. I mean, it just like with because I've done addiction medicine, a lot of the patients feel so closed in their own world that they don't see that there's different opportunities to think differently. And know that other individuals, might have exposed them to something that they never thought about just because they're kind of siloed. Unfortunately, and there's a lot of stigma, but thank you for doing all that you do. And I appreciate you signing up to kind of be on our guest interview and being here in person for Psych Congress.